A winged scapula is someone's shoulder blade that looks like it's kind of poking out laterally to the side. It looks like you can go up to them and just kind of dig your fingers underneath there because that scapula is not properly centrated on the posterior rib cage. To understand why a scapula might become winged, we should appreciate the role of scapulohumeral rhythm. That basically just means that there exists a relationship between degrees of scapular movement and degrees of humeral movement. For example, when we go overhead, we're going to have a relationship of, for every about 2 degrees of overhead movement within the humerus, the scapula is going to move 1 degree. So as we go overhead, it kind of looks like this. That's what the scapula needs to do. But if it can't, for whatever reason, stay on the rib cage in a normal mechanical way, then it is going to basically deviate outward to help itself accomplish the task and meet the demands of the life that this individual is living. When upward rotation in the scapula happens, that's primarily controlled by the traps that attach on the medial border here to pull it up like that, and also the serratus anterior, a muscle that attaches on our lateral rib cage that helps pull the scapula into that upwardly rotated state, but it's also massively important for keeping the scapula centrated on the back rib cage. So when you do see a scapula that's winged out, usually that's due to a loss of function or firing patterns within one or multiple of those muscles. Another way a scapula can become winged is if we're rotating our trunk to one direction more so than the other, which does play into the position of the pelvis. I will link a video that talks about uneven shoulders and how that can play into a winged scapula. So let's say, for example, we had a pelvis that was oriented to the right. So we then reorient our trunk back to the left up top so that we can straighten out our posture. Well, the right scapula, like right here, this is a right scap, is going to come forward and wing out, or it's more likely to, because the trunk position is helping pull that scap forward. Because the scapula is being pulled forward, the humerus is going to be pulled forward with it. Now, when that happens, we're going to be pulled into an internally rotated state, like so. So the measurements of internal rotation at our shoulder and other associated measurements like adduction and extension are usually limited when you have a winged scapula. So those are a couple of tests that you can do to determine if your winged scapula is truly limiting your range of motion. Because you can't get somewhere you're trying to get, aka internal rotation, if you're already there. So because of the position of this forward shoulder and internally rotated humerus, that looks kind of like this. So you can see how my pec might be in a shortened state, and there would be compression going on this side of the rib cage. So yes, I'm going to bring breathing into this like I do most things. But it's an important consideration because when this shoulder is pulled forward, we're going to have compression within this side of our rib cage, because when we breathe in, we should be able to have that shoulder come back, and the scapula does need to come back upon inhalation. In my opinion, the role of the rib cage is the most overlooked aspect of these types of issues. People want to go right to the scapula right away and reorient it on the rib cage to help it not be as winged. But if the rib cage can't move to allow the scapula to reorient on the rib cage, then it's going to be difficult to have lasting changes. So the first step is to expand the rib cage in the front. Can we get air to expand here to bring the shoulder back? The next thing we want to do is then go ahead and go after the muscles that will help bring the scapula from a winged state to a more neutral resting position. So we can do that via 2 main muscle groups, and that is the long head of the triceps and also the low trap. Those 2 muscles are going to be very important for helping reorienting and bringing that scapula back on the rib cage. So when those 2 muscles contract and a scapula is out here, they're going to pull the scapula inward and then recenter it on the posterior rib cage to allow for a more neutral orientation for it to start from. Here I'm just grabbing a quick measurement of my internal rotation, which is measuring, can I get air into my anterior rib cage? If I could get 70 degrees, that would be an indication that I could. But I'm short here, so that's an indication that my ribs in the front are in a depressed internally rotated state, limiting my range of motion. So I then need to expand them. So for this activity, what we want to do is we want to rock back onto our heels in an all-4 position. We want to bring one elbow out in front and then press it slightly into the ground, and that should give you a nice stretch on the side of your rib cage, your lat, which likes to get tight with your pec and pull that shoulder into internal rotation when there's a lack of expansion.
So turn your head to the same side and then think about pulling your butt away from the elbow that's on the floor. Again, it should be a moderate stretch, nothing crazy. Breathe in through your nose, out through your mouth, nice and relaxed for about 5 breaths, and then let's retest. After we've ensured that we can get air into the anterior rib cage consistently, we can use this side plank progression to ramp things up a little bit. So get in a 90-degree bend at both your knees and your hips, push the floor away with your bottom side knee and elbow, and that should turn on your abs on the bottom side. That will promote expansion going up top into the rib cage, and you can also press into that wall with about 5 out of 10 pressure. That should allow you to isolate the long head of the triceps as well as the low traps. We don't want to press too hard because then that might kick in other muscles we don't want firing in this position. So make sure your elbow stays a little bit unlocked and you're staying relaxed. As you inhale, you should feel expansion happening on the top side. And as you exhale, you should feel those bottom side obliques or side abs work harder.